Welcome everyone to this session today. We're looking forward to presenting this our sort of experiences and knowledge of what a patient-oriented research approach is to research to this group. I will be leading more or less the moderating and facilitating the session, and Larry and Kristi will be mostly the talking heads that you'll be listening to today. We'll also be trying to set aside some time for questions and interactions. So if you're wanting to put your questions down through chat, please, if you could remember just to submit it on your chat box and submit it to everyone so we can all see those questions. And then also you'll have the opportunity to unmute your mics as you go if you want to, and or raise your hand in the participant panel. So we'll try and make sure that we can connect with everyone and address any questions that you have. I also just want to start off by saying that we have no specific conflicts of interest to declare, and that some of the images that we may be presenting today in our presentation may have the copyright protection, but we're presenting them for educational use only. And the other thing is there was supposed to be a handout for all of you ahead of time, but we will certainly create a PDF with these slides for you, and that you can that you will have access to after this talk. Next slide, right? There, next slide. Thank you. So we're tag teaming from remotely, so as everything goes, I'm sure there'll be a few interesting glitches as we work our way through. And I think that's probably just an opportunity for us to all appreciate that we are going through some interesting times and changes in how we do our daily lives, and connecting remotely, I think, will be sort of a strategy that we will become more familiar with over the next few weeks as we all move forward. So thank you for your patience if we do get things a little messed up today. So what we're hoping to do over the next 45 minutes or so is just review some of these learning objectives. As in the research world and in the healthcare system, you know, the world is filled with acronyms, and hopefully by the end of this session, we will have introduced you to these three new acronyms that you may or may not have heard and understand what they are. We're just going to give you an introduction to a strategy for research that's referred to as patient-oriented research, and hopefully by the end of this session you'll have a better understanding of how this approach to research could relate to the work that you're doing. And most importantly, we're wanting to sort of not just present what it is theoretically, but give Kristi the opportunity to present to you sort of her experiences as a patient partner in many aspects of research, and that will be a large bulk of what this presentation will be today. So that's what we're going to cover in the next few minutes, and at this point I'll pass the slides and the mic over to Larry.
Great, thank you very much. First of all, thank you everyone for coming today, and thanks for having us here for this webinar. I think I'd like to start by just doing a little land acknowledgement that we are on the unceded and ancestral territories of the Coast Salish peoples, and so we're grateful for that to be here today. I know we're a dispersed audience, so it might be on very different territories, but I just thought I'd lead off with that. But first of all, I think, as Lynn pointed out, there are lots of acronyms, and probably the worst of them all is SPOR in some ways. But it's a great initiative that was started through the Canadian Institutes for Health Research. And who are they? And for those who aren't necessarily researchers, though this organization is the main funder of health research in Canada, and SPOR is an initiative that was created through that institute. SPOR was created, and it actually stands for the Strategy for Patient-Oriented Research, and it's Canada's strategy to ensure that the right patient receives the right intervention at the right time. So when I tell people that's one of the mottos of SPOR, they'll say, "Isn't that happening already? I know, isn't that happening now?" And so people are often surprised to learn that in fact that's not necessarily the case. In some ways, Canada is known to be a country with lots of great pilot studies, But there is a knowledge to action gap. That is, there is a distinct gap between the knowledge that's generated and created by research in Canada and that knowledge that's then translated into actionable research in the healthcare system. So we see that as showing up as a 12 to 17 year lag between the time that research is created, knowledge is created, and the time that it actually makes it into practice. We also see that only up to 15% of the research that's done in Canada actually makes that journey. So not only does it take that long, but not all of it makes it there. So we have a huge body of research that's not necessarily translated into practice. We also have some estimates that up to half of the interventions that occur in the health system currently in Canada are not evidence-based. That is, that they don't necessarily have the stringent scientific evidence for it that we would like to see in all of the interventions. So there's definitely a room for improvement there. And there's some estimates that even a quarter of the interventions that are given might not be working at all or might be actually unhelpful or harmful. So SPOR was created to sort of address some of these various issues. And the way that SPOR decided to deal with this, this knowledge to action gap, was to fund and create support units. And the word support is actually an acronym itself. And it stands for Support for People in Patient-Oriented Research and Trials. There are 11 support units across the country. Every region, territory, province has access to a support unit. When these were created, they were all created differently. When the SPOR initiative was started, CIHR decided they wanted to make it relevant to the context of the different regions of Canada. So in that spirit, the BC support unit is also a distributed model, and that is that we have offices in each of the different health authority regions in Canada. So there are 5 different regions that, in BC, I meant. So there are 5 different regions in BC, each with a health authority and university that's partnered together to house support units across the province. And in Vancouver, we're a little bit different, but Lynne and I operate as the same sort of service provider here in Vancouver that the other offices offer in the other regions of BC. So what do we do with the support unit? Some people have heard of us and some people haven't. There are 2 major components of the support unit. We have, first of all, I should say we have 49 partners. It's quite a large project. We are funded through CIHR, through SPOR, and we do 2 basic things. One is the practice of POR, and that is that we work to develop and build the capacity to do patient-oriented research in BC. But we also study the methods. And, we have to think of patient-oriented research as more of a process than a method, perhaps, because it can be applied to any type of research method. But we do look at the best practices for doing patient-oriented research. What are the barriers? What are the opportunities? How do we make sure that when we do patient-oriented research, we're doing it well? So that is the part of the support unit that studies these methods, the science of doing patient-oriented research. Together, those work together, combine building the capacity to do it and then building the knowledge and the evidence base for doing it right. That's the sort of the main thrust of what the support unit does in BC. So let's just take a step back again here, because I keep talking about the strategy for patient-oriented research, and we are advancing the knowledge and practice of patient-oriented research. But what is POR? What is it actually? So if we look back to CIHR again, we see that it's a type of research where we actually invite non-traditional researchers into the research world. You think of the traditional way that research is done is that researchers come up with research projects, conduct them, create knowledge, and then that knowledge somehow gets to the health system. So in this paradigm, underneath the strategy of patient-oriented research, we actually are looking at engaging patients as partners in the research process, and looking at research that focuses on patient-identified priorities and patient-identified outcomes. So patient-identified is the key here. So by engaging patient partners in the process, we hope that we're actually going to be doing that. We're going to be looking at what their priorities and outcomes of importance are. But we also note that the support unit, or that the strategy also includes other relevant stakeholders. And those stakeholders include care providers and the decision makers. Who decides what interventions are going to be delivered at what time, and who's actually delivering those interventions. So these are the four major stakeholders that are conceptualized under the strategy for patient-oriented research as being the four stakeholders that are absolutely necessary to conduct patient-oriented research. And of course, this is all working to ensure that the knowledge that's generated is going to improve healthcare systems and practice. So why did the strategy for patient-oriented research choose SPOR as its vehicle for bridging the knowledge to action gap? There's lots of different reasons for this. There's lots of, as this diagram shows, this photo of the push me, pull you from Dr. Doolittle, which our colleague Allison has provided us, which is a good reminder that there's both a push and pull to do this work. CIHR has grants that are specifically require a patient-oriented research approach. There are journals and including the British Medical Association Journal, Canadian Medical Association Journal, and a couple of others that actually require that patients are engaged in research projects that they publish articles on. So there is lots of reasons why patient-oriented research has been put forward as a way of moving the knowledge forward. And then, of course, there are lots of patient groups and the public who are asking to have a bigger say in the knowledge that's generated and how research is done, considering that most of the health research in Canada is funded through the public funds. They want to have more say in what research is done. So there's lots of reasons and lots of reasons why to do this. We've probably heard the expression "nothing about us without us," which is now being applied to patient-oriented research in this way that the people who are going to be affected most by health research should have a voice in shaping that research. And there are lots of different reasons why having stakeholders, these four stakeholders in SPOR is important. It increases the relevance of the research. Doing the best research project that creates the best intervention in the world that is irrelevant to providers and patients, and that policymakers don't want to fund, it's not going to help. So increasing the relevance, the uptake of research into practice, access and effectiveness, there's lots and lots of reasons why patient-oriented research is considered to be an important way of shaping the way research is done in Canada. And of course, this is done in other jurisdictions as well. In the US, the UK, and other countries in the world, they've taken this approach as well. So I want to take a step back a bit and talk about the word patient, because it is called the strategy for patient-oriented research. And we are often talking about the word patient, but you know, that word is loaded. So I put up this word cloud here to show some of the other words that might be used in replacement of the word patient, or sort of give us a broader view of what we mean by the word patient. But since we have Kristi on board here, I'd like to ask you, Kristi, what do you think about the word patient?
Thanks, Larry. For me personally, I'm more than comfortable with using the term patient because that's personally how I identify myself. But I think what is really critical to remember is to just have that open dialogue. Ask your patient or your family member, you know, what term they relate to, what term they feel comfortable with. Because really, that's what's important. And above all, it's remembering the value of that lived experience. So it's not as much about getting bogged down in the terminology, but it's being aware of what, you know, what your patient's family members want to be referred to, and just recognizing that lived experience.
Mm-hmm. Thanks, Kristi. And that's really important to note, that you think that when we create a research team, we want the experts around the table. We want stats done, we want a statistician. If we want, we really need to have that expert view from the patient partner, from the patient who has lived through the experience that we're studying. So that provides us with that lens, that aspect that we don't necessarily have ourselves. No matter how much research you do in a certain area, you don't know what it's like until you've lived through it. So when we use the word patient, I invite you all to replace that word with the word that makes more sense to you and your community of interest.
Yeah, thanks, Larry. And I just wanted to add one comment there too, is that, again, the patient does tend to also highlight the sort of the patient partner or public role in the patient-oriented research strategy. but keeping in mind again that the strategy really does embrace all of the stakeholders and partnerships. So sometimes SPOR is just about partner-oriented research as well. So we find that we spend more time explaining, just like we are in this presentation, about what do we mean by patient-oriented research. But it is called different things in different parts of the world, as Larry mentioned, and also it's also not necessarily a unique strategy or methodology. It's very common or very similar to strategies like community-based research, participatory action research strategies, some of these other collaborative research methodologies, or an integrated KT strategy. They're actually all quite similar, and at the core, it's about engaging the people that are going to be most impacted by the research in developing the research right from the beginning. So again, that's just a way of sort of trying to bring it all together. Thank you.
Thanks, Lynn. So yeah, absolutely. So before we launch into a little bit more about what is patient-oriented research, I'm going to take one moment just to say what it is not. Patient-oriented research is similar, but it's not the same as patient-centered outcomes research or measurements, PROMs and PREMs, or qualitative research. Those are all important methods that can be used in patient-oriented research and are quite valuable tools, but they are not necessarily the same as patient-oriented research. And so I hope that'll make a little bit more sense as Lynn is going to unpack a bit more about what patient-oriented research is, and the idea that you're not doing research for, but with or by the stakeholders that you're engaging in the project. So a rule of thumb that I always mention to people is that if you're engaging a patient as someone who's providing you data, that's not patient-oriented research, and that includes PROMs and PREMs. It's when a person is helping you make decisions about your research, that's when you're engaging them as a patient partner. But let's go into a little bit more about what that is. I think Lynn is going to take us through some of the levels of engagement now.
Great, yes, thank you, Larry. So when we talk about levels of engagement, we can think in a bit of a spectrum. And right from in this diagram here, it's kind of like a steps up from sort of the lower level of engagement, where you're engaging with your stakeholders and what you're sort of doing this one-way informing. This is kind of our traditional approach in research, to create the research and then disseminate information at the end, informing this is what we did, and we really hope you like what we did, and we really hope that you take it and use what we did. And it's not a bad way for engaging and with patients and public, but it may not necessarily be effective in terms of supporting and improving the uptake of research. But at the other end of the spectrum here, we have the concept of the patient or the stakeholders as actually leading and informing, not just being engaged in it at other levels, but actually leading the research. And there are strategies in which patients and public and community members are actually deciding on what the research is, funding the research, and engaging with the research as partners on their team to help them do it well or differently. And in the middle, and that's kind of where we are living in the sort of patient-oriented research world, and sort of how it actually plays out, is more of this middle layer in which the stakeholders are involved as members of the research team, but and supporting and making decisions in the research process. And the one thing that's important to consider is that when the more you're engaging with other team members in your research, and of course it does take more time and energy to sort of create that, and also it does include or require increased demands, both in terms of direct financial costs in terms of your budget, and also resources and financing within the research team. So it's money well spent, we'd like to think, but it's important to remember that it doesn't come for free. And so we'll just put it through in terms of the spectrum of engagement doesn't come new to patient-oriented research. It actually comes from the IAP2 engagement spectrum that has come about engaging public in all manners of decisions, and including public works and bridges and everything. So again, this is just the same spectrum, and where we're aiming in patient-oriented research is in this collaborate area in the spectrum, where we're really trying to partner with our stakeholders in a meaningful way so that we're all working together in a shared decision-making strategy to sort of help inform and move research forward. So in addition to different levels of engagement, there's also very many different types of engagement in which patients and stakeholders can get engaged in the research process. And so we talk about this as the patient roles. And so at the highest level, patients and stakeholders can be involved in the governance. And so this is, of course, actually informing how the organization or the research institute itself is organized and running. And so that's a very high level. And there's a number of research institutes that certainly do have patients as partners in the governance. And the BC Support Unit, we do have patient advisory council, which is a little bit different. We do actually have patients sitting on our board of governors. Patients actually play a significant role in funding of health research in Canada. Both Michael Smith in BC and the Canadian Institute of Health Research are fundamentally have patient partners engaged in all of the funding decisions, even if it's not a specific patient-oriented research strategy. They're sitting on the review committees. They are engaged in the advisory councils in these funding organizations, and they are sitting on every single research panel, a review panel, and contributing to the decisions as who's being funded. So even if you're not directly engaging with patients in your own research, patients and the public and other stakeholders are in fact supporting the funding decisions. The other way the patients are very commonly engaged in research is sitting on advisory councils, either in some of the research methods clusters that you guys may be engaged with, or some of the research institutes that you work with. They have patient partners, again, and the different stakeholders sitting on the advisory council, not so much in the government's level making decisions, but providing recommendation and direction. As well, patient partners are engaged in helping and getting involved in a number of priority setting activities, whether it's just within a specific research a PI who's helping and trying to help decide what the research priorities are, or more directly in sort of what's actual outreach and discussion groups to help set priorities for research questions. And probably the most common way is we'll pass this on to Lori, is Larry. Lori's my daughter's name, sorry. And really is engaging partners as actual team members. So back to you, Larry.
Absolutely, thank you, Lynn. Yeah, so as Lynn said, this is probably, we're sort of focusing in on this area because this is most likely where you will be experiencing patient-oriented research in the work that you do, is involving patient partners as team members. And this can be a balancing act, and you're balancing the researcher's needs and expectations against the patient's knowledge, skills, abilities, interests, etc. Because, you know, when we think about it, we're actually inviting someone to join the research world who's not a researcher, not a traditional researcher. So we need to make sure we create an environment where that person is welcome and supported. And that's some of the work that Lynn and I do, is work with research teams and patient partners to make sure that they're integrated well into the team. I can't move forward here. Okay, there we go. So this here is just a little visualization of the research cycle. And I'm not going to go into it too much. This was created by just one researcher, and I'm sure that if you had any researcher on this call come up with their own cycle, they'll come up with something slightly different. But the point of this is that in any one of these stages, we can identify places and times and in the research cycle where different patient partners can take different roles at different levels of involvement. And it's just a matter of figuring out where in the research cycle that you can engage patient partners. And it might be different for every research project. And a patient might be involved at different levels and at different times in one research project. So there's just some things to consider. But overall, when you're doing this work, you really have to consider these three things: the level of engagement that Lynn told us about. How are you going to make sure that their feedback is going to help you with your decision making? How will you make sure that that's meaningful collaboration you're doing with your patient partner and your other partners? You know, what role do you want them to do? What role do they want to do in the actual research cycle? When and where are they going to be engaged, and how are you going to support them in those different times and places? So we're just going to take a moment and see if we have any questions before we move on. Now, I don't know if someone can check the chat box to see if there's any burning questions. And if not, we'll just go on with Kristi, but we'll just take a
So
moment.
yeah, there's no questions that I can see in the chat box at this time. And just again, just to reiterate, it really is important to understand that a patients and stakeholders, meaningful engagement of stakeholders in research doesn't mean they have to be engaged at every stage and every phase and involved in every decision. So it's about, engaging with people in a meaningful and appropriate way so that's actually helpful for both parties. So that's just a bit of a reiteration there. So seeing no questions, and I'm not also seeing any hands up in the chat, in the participant box. So why don't we move on, let Kristi provide us with her experience as a patient partner at many levels and in many different ways. So over to you, Kristi.
Great, thanks, Lynn. Hi, everyone. I can't see you, but I know that you're there. I just want to echo Larry's earlier sentiment, and thank you all for joining us. I know that it's kind of with everything that's going on in the world right now, we all have a lot on our plates. So I appreciate you joining us, and hopefully you're able to take away a little bit from today's discussion that you can apply to your own practice or your own work. So for me, I am really excited because I'm looking forward to sharing with you a little bit of my own personal experience as a patient partner, as well as share with you some of the highlights from my professional side with the Transplant Research Foundation. But I do want to start first with my own personal journey with research and in life, because I think that it provides an important context for why I'm passionate about research and why the patient and family member's voice is so important in research and being part of that journey. So for me, my experience with the healthcare system has really been lifelong. I was born with a congenital heart defect and underwent my own, my first actually open heart surgery at 9, which was followed by a pacemaker at 12, and subsequent open heart surgeries at 15 and 16. And by the time I was 17, I was facing a heart transplant. Unfortunately, at that time, there was no pediatric transplant centers in BC. So my mom and I had to pack up and move to Toronto, where I received my transplant. And I've been very fortunate because this August will actually mark 20 years for me since my transplant. And of course, those years have not been without their challenges. There's been a lot of rejection and infection and various other comorbidities that, of course, stem from all the medications I'm required to take. But nevertheless, I really wouldn't have changed any of it. And I've really witnessed over the last 19 and a half years that the firsthand how research has really impacted my quality of life and really led to my survival. And for me, that's why it is so important that I'm able to be part of research, because I'm directly impacted by the research that's being undertaken. And it's really, if you think about it, as a patient, as so many other patients and family members know, I am the one that, really has to take those handfuls of pills every day and has for the last 19 years. I'm the one that has to really manage the side effects that come with that and live my life. And I'm the one that has to undergo all the painful, biopsies and angiograms and everything else that my life entails. And when we talk about research, it's really is people like me whose life is on the line and is directly depending upon the work that's being undertaken. And it is this experiential knowledge that is so key, because as Larry and Lynn have alluded to, you really can't know what everything there is to know about an illness or a disease unless you have lived with it day in and day out. Unless you've walked in a patient or family member's shoes, you can't possibly know all the nuances that go along with a diagnosis or a condition. And that's really why this lived experience is so vital to that research piece. And next slide. Thank you, Larry. Thank you. And really, when I think personally about patient-oriented research, it's really about bringing together all these different worlds. So bringing together, our researchers, the clinicians, our patients, our families, as well as other stakeholders, may it be funders or decision makers. The list is really quite extensive. And it's about bringing together those pieces, bringing together those voices, those perspectives, so that the research piece is, and the research picture is really more inclusive, it's representative, and it really can, I think, just be really reflective of everybody. It's not too narrow in scope. And I know that for some of you, when we're talking about patient-oriented research, it might require a little bit of a transformational shift in perhaps your current thinking or how you're currently practicing, and that's okay. You know, I assure you though that it is possible, and that it can be done, and that it is being done. And for me, personally, I know, as I listed on this slide, these are just a few of the roles that I've had in research. Of course, as you recall, the list is, you know, it exists on a spectrum. And for example, right now, one of the projects that I'm actually a patient partner of is a project funded through Health Canada, and it's about engaging and empowering patients on their transplant journey. And I'm fortunate because in this project, I've actually been able to be involved at really the highest level of engagement. So that would be that empowerment and that collaborate level, the top of the spectrum. So for instance, myself as well as some other patient partners, we were really able to help set forth the research priorities for the project. We were really able to be part of shaping the content and the scope of that research project. So what was being studied and what the focus was really relevant to our transplant community. In addition to that, we're still a little bit in the early stages of the project, but nevertheless, I've also been part of the hiring process for our project coordinator. So I've been able to help inform, or I was part of designing the research questions from a patient lens. And I've also been able to, I sat on the hiring process or hiring panel, and I had a say in who was hired for this project. And if you think about it, to some extent, this involvement, it really just makes sense, especially for projects that involve patients and family members as research subjects, or if you're hoping to obtain data from patients and family members, really engaging a patient or family partner in the early stages. It can help with such things such as, you know, enrollment and recruitment and retention, as well as many other areas of the project. So I think, oh, sorry, next slide, Larry. So for me, those are just a couple very brief examples of how I've been involved. But I do want to shift it a little bit more to what we're doing at the Transplant Research Foundation, because that's really been, our core initiative has really taken up a large part of our work for the last year. So for those of you who don't know us at the Transplant Research Foundation, which I'm sure is a lot of you, we provide funding to BC-based clinicians and scientists who are conducting organ donation and solid organ transplant research. And we do this through 3 of our main funding programs. We have our venture grant program, which provides seed funding for new and novel ideas. And then we have our research partnership. And that has been in collaboration with Providence Healthcare and Vancouver Coastal Health for their team grants and the research challenge competition. So that's targeting more of the frontline staff and our health clinicians. And then we also partner with the Canadian National Donation Transplant Research Program. So as the name entails, that is a national research program, and we provide funding for research, for pediatric research programs through that. And so for our core initiative, it's been a relatively new initiative for us. It's a new endeavor, but it's no longer in its infancy. We began it about 1.5 years ago. And it really came about from a variety of factors that were all kind of at play around the same time. It was at this time when our board of directors really was beginning to recognize the inherent value in engaging patients in our work. And we really were wanting to become more transparent and accountable to our transplant community. In addition, the CDTRP had just put forth a set of patient-identified research priorities in transplant. And those have been compiled out of quite extensive collaboration among researchers, clinicians, patients, and family members across Canada. And we recognized for our organization that we didn't have the capacity to really emulate that study on a local level, but nevertheless, we wanted to integrate that into our work. And it was also at this time that we were in discussions with Providence and Vancouver Coastal related to the team grant competition and discussing, what we wanted the scope of that award to entail. And for those of you who are familiar with them, I'm sure you know that they are really quite progressive in their patient engagement strategy and in all their grant programming. And they were really supportive of us wanting to, make patient engagement a requirement of funding to integrate those patient-identified research priorities. So, the slide disappeared, Larry. That's okay. But so from there, what we did is we recognized that we weren't really, thanks, Larry. We recognized that we weren't able to just put that out there and hope for the best. That we really had to help build capacity in a research community. And so how we began that was, from one, we were working extensively with the BC Support Unit, but we began a series of workshops with Providence, Vancouver Coastal, BC Support Unit for our clinicians, our researcher, our patients and our family members to really help build their skill set, their awareness, and their understanding of what SPOR was, as well as provide some more tangible ways to practice that work. And I just want to, bring your attention to kind of the picture that's on the screen right now, for those of you that can see it. And this was actually a picture that was compiled during one of our workshop activities. And we asked our in small groups to put together what the research cycle looked like, and also where you could potentially involve patients and family partners in that. And as you can see, really at any stage of the research cycle, patient and family partners can be part of the research. I think that's an important point to make, like Lynne had already done, but nevertheless. So in addition to those workshops, we also have had various onboarding sessions to train patient and family partners to be peer reviewers for grant competitions. And this is, I think, really a unique opportunity because patients and family partners are reviewing these project proposals from their own lens, and their feedback has really offers an opportunity to help strengthen those projects and to really enrich them. And maybe perhaps their suggestions and ideas wouldn't have otherwise been considered without their involvement. Next slide. And from there, that's what we've been doing. So now we're kind of in the point where we're looking towards the future. We're going to continue to really build our momentum and continue to host workshops. And I'm really pleased and proud that we've been able to have 42 patients and family members be part of those, as well as 34 researchers and clinicians. And I know for us personally, we are continuing to really help embody the principles of SPOR into our venture grant competition. That's what we're moving towards this year. Continue to grow our pool of trained patient partners. As well, I'm finally starting to see that our community is embracing it. More and more, I'm connecting researchers and clinicians on projects, sort of a matching exercise. But it's really been, I think, an output of what we've been doing over the last year. So next slide. And really, I don't have a lot more to say, being cognizant of time, but I just want to close on the fact that I think it's important to really remember that we all have something to contribute. And regardless of where you're looking at to engage patients and families in that research journey, one of the most important points is to really recognize that point that they all have something to contribute, and that we really need to respect and value everybody's unique perspectives and contributions. So I will just end it there and throw it back to Lynne and Larry and see if there's any questions from all of you.
Great, thank you very much, Kristi, and that was excellent. And one of the advantages that Larry and I have had over the last 2 years and really sort of working and building out capacity through Vancouver is having the opportunity to really work closely with some incredible patient partners such as Kristi. And, you know, we can go out and, you know, speak about why this is such a good idea and maybe you should consider it, but it is about building that relationship and developing that capacity, and the commitment to have this approach work does take some time, but it's been resulted in some really amazing and incredible outputs that we're all very proud of. So thank you, Kristi. And there's nothing like seeing how it actually can work from someone who's doing it versus Larry and I talking about why it might work. So that's kind of our initial outputs. I'm just wondering if there's any questions. We can open it up to the floor. Otherwise, I'll just maybe, I'm not seeing anything coming up in the chat box. So maybe then, while we're waiting for people to do that, is just to come back to you, Kristi and Larry, because the two of you, I think you started your sort of journey in patient-oriented research probably a couple years ago together. So Kristi, is there any comments about sort of something you hadn't really thought about that you, or surprised you, or a challenge, or some of the takeaway looking at it 2 years retrospectively, knowing where you are now and where you started, that you would like to share?
I think for me, initially it was daunting. It was a little overwhelming. I had just started my position here at Transplant Research Foundation, and this was really important to me as well as our board of directors, but nobody really knew where to start. And we recognized that we wanted to do it right. But again, where do you begin? And that's really where, of course, you know, we reached out to BC Support Unit, began a partnership with you and our discussions with Larry. And I think it's important to recognize, you know, you don't have to go at this alone, that the BC Support Unit has extensive resources and supports to help you in this journey, whether you're a researcher, a clinician, or whether you're more of in a program role where you want to implement it at a little bit of a higher level, that they are a really excellent resource, and that it can be done. You know, it starts small, it's a process, and just to be patient and know that you can get there.
Larry, what are your thoughts?
Well, that's very nice, Kristi. You know, it was a great pleasure to meet you when we first started out, and I think that was kind of the focus of it. The first few interactions that we had was kind of building up that relationship and sort of understanding where you were with what you were doing and where the Transplant Research Foundation was. And I think, you know, even at the beginning of this, there was still some resistance, you know, maybe from the board at the Transplant Research Foundation, but I think you really demonstrated that it just takes someone with that drive and ambition and just that sort of faith or confidence that they can move it forward. So, you know, it's been great working with you for that. I really appreciate your energy in moving it forward. So
great, thank you. Yeah, so the other thing we just wanted to highlight is that, as Kristi mentioned, that that's what the BC Support Unit is there to do, is to really help you address those questions. And if your question is, where do I start? Or if you have some questions, where do I find more information about what patient-oriented research is? We just, you know, or you want to just sit down and you know, have some sort of training that's unique to your group of people, just to consider, is this something we actually want to even do? We can come out and do those outreach activities with you to sort of help you problem solve. What could this mean for you? Where do you start? Where are some resources? And sort of the best way to connect with us is actually through our website. We have it's just bcsupportunit.ca, and at the very top right-hand corner, there's a little inquiry form. You just click on that, and it leads you to, you know, whatever your question is, it will be redirected to someone to help you with this question. And keeping in mind, if you're from Vancouver, then the inquiries will be directed to either Larry or myself. But if you're working in work partnerships in other regions in BC, these inquiries will go to the regional centers in Fraser Health and Interior Health, island and up north. So it's about, again, sort of like Kristi was saying, is building and connecting you with the right people to address your questions. So please take that opportunity to go into our website and do that. So just any final wrap up thoughts from anyone, or if not, then Cyprian will hand it back to you.
I have one. One more thing, and again, I know our audience is broad, but I do want to let you all know that I think it's important. You may be coming away with this thinking, I don't know if a patient or family member can really have any value or useful, input or contribution to my project or my work, especially if you're doing a little bit more of that bench research. But I assure you that they can, and that again, it's about where in that project can they best fit. And it can be right from the very beginning, helping you inform your research priorities, helping you design your perhaps your questionnaires, or helping recruit, or right through to the very end with that dissemination and that knowledge translation piece. Getting the results of your project out to the patients, to the people who really matter. Because I know that all of you, what you're doing is because you want to improve quality of life. You want to improve patient survival. So I think just recognizing that there is a role, no matter really what you're doing for patients and family partners. And again, we can help you with that if you're not really sure what that looks like. That's all.
Thank you, Kristi. Cyprian, any wrap up?
Well, I see there is one question. It's from Luisa. She says, hi, Kristi, great presentation and perspectives shared. I wondered if you could say anything about any power imbalances, differentials you might have experienced, if at all, and how you overcame these feelings.
Yes, that is a really big one, the power imbalance. And I have found that a lot, and I know a lot of other patients and family members, they do experience that, because you are entering into a relationship where there is that power imbalance, where you have, to some extent, a professional who may be acting as the expert and think they are the expert. And it's about really, you have to break those down, and you have to really recognize that this is only going to work if you're seen as, equal partners. And it's about that respect, and it's about that valuing of everybody's contribution to the piece. And I think that is a really important one. And some of the ways that I found that it's helpful to overcome that, it's, for one, having that really safe space, that safe relationship where you can, if you have someone even on your project, that can be designated as that contact for a patient partner, so that they can continuously check in with them. They're that, that person who is with them along that journey, who can, take their feedback to the rest of the team, or take their feedback back to the rest of the team, who can really, your patient, you don't want your patient or family member to just be out there floating around and hoping for the best. It really does require active engagement. You do have to be aware that it's kind of a relationship that does require, to some extent, a little bit of nurturing. So I think that is a very real condition that exists, that power imbalance, but there are some steps that can be taken to help remedy that. I hope I answered that sufficiently.
Great answer was the response. Thanks, Kristi.